tonight we are going to invite my friend, Dr. Theresa Marko on, and we just had a little glitch on Instagram, like, hello from Chicago, hi, welcome. So we just had a little glitch. So if we happen to like bounce off, come back on, tonight is going to be really packed with, Theresa's got some pretty mind-blowing information for you when it comes to advocacy as well as insurance information. So for those of you that have gone through this pandemic, you should know, as well as we know, how hard it's been just in the medical community, but also for patients and patient advocacy, and even understanding how to use your insurance at this time. So we're going to walk into that today. So I want to introduce you all to my friend, Dr. Theresa Marko. She has been a physical therapist since 1999. Right? It's been a long time, T. I know, I was thinking about that. I'm like, I graduated in 97. It feels like a million years ago. So she is a private practice owner in New York City, and we both kind of went through the whole woes of COVID this year. And it's been kind of a rough year for us in 2020 with our private practices, but Theresa catapulted herself through that. She's now working as an adjunct professor at Stony Brook University, and we're going to get into it later, but she happens to be like a Twitter badass. So she utilizes her social media for some pretty interesting things when it comes to advocacy. So yeah, anyway, I'm going to kind of let you tell the story of how you got in health advocacy. And I already know that part of it has to do with me and our, you know, crux of things around dry needling. But I want you to tell everyone, you know, where you started in this journey.
So I think people become passionate when something changes their life. And I would say several years ago, before I met Bianca, I was in a lot of pain, and I, as a physical therapist, tried treating myself and getting better. I did my exercises, I did self-mobilizations, I had other physical therapists treat me, but I just wasn't getting better. And it got to such a severe point that I went to physicians' offices, I had MRIs, they were talking about injections and things like that, possible surgery for my hip. I was having all this nerve pain going down my leg to such a severe point that I remember walking through Central Park with my husband and just stopping and just saying, I can't do it, I can't walk. The pain was so severe. I would cry sometimes at night, and I just was in so much pain. I thought, wow, this is how it's going to be. And at the same time where I was working, I was looking for people in the neighborhood to be resources for my patients to refer out. And I happened to see Bianca on Chemo Wellness's website. And I said, that sounds pretty cool. So I invited her to my clinic to do a demo for us. And she took time out of her busy life to do that. And that, gift of hers changed my life forever, because through that I decided, well, let me try to have her do the dry needling to my own body and just see if that helps me. And it made a world of difference. And the combination of the dry needling and the release of my muscles, I realized I was having a severe fight between the front of my body and the back of my body, front of my hip and back of my hip. And that in combination with then doing my exercises made everything better. And I no longer struggle with that severe pain. I get flare-ups and it comes back, but it's something manageable. And I see Bianca for a tune-up, and of course I do my own PT exercises. So I became really passionate about the needles. She knows I love the needles. I've sent many people to her. But the truth is that Bianca's a master clinician at what she does. And I've been needled by other people who didn't do it quite as good as her. So she's a true master, and, I owe a lot to you, so thank you. But so the needles, I became so interested in them that I wanted to know if I could use them as a tool on my patients, because it was such a gift to me. I wanted to give that gift to other people. And the needles it's illegal for physical therapists to use them in the state of New York. In many states around the country, it's legal and it's considered a tool we can use, but in New York, it's not. So that's an advocacy issue. And I became so interested in it and why could we not do it, and what the status of that was. I started to research it, and at the same time I was doing my transitional doctorate in physical therapy degree, and I had to do a capstone project, and that's what I did my capstone on, and I found out a lot more about it. But at the same time, I was taking an advocacy class while all that was happening during my doctorate degree, and I found out about advocacy and realized that the system that I had been working in all these years, there were things that were just annoying, like prior authorization and all the things that we might talk about later, that the system is a little bit broken and aggravating to be in, working in as a healthcare practitioner. Anyone who is a healthcare practitioner will tell you that. And so I realized that you could make a change in those things. You can make an impact by working with your legislators, by working with your professional association to try to change the laws. And a light bulb went off in my mind, and I realized that the people making the laws, the legislators, were making laws about my life and my practice for my patients and my profession. They really don't know what we do or how their judgments have an impact on my life and my patient's life. And so I wanted to get to know them and reach out to them and educate them so that we could change the laws for everyone's benefit. And that basically is what advocacy is. Advocacy is you reaching out to your members of Congress, whether that be on a federal level or a state level, to try to get them to change the laws that will improve things.
It's interesting because even just us as practitioners with these crazy laws that we have to abide by, but I mean, I don't know about you, but I have certainly many patients that also struggle, like the cancer patient that can't get a PET scan, right? Because of these laws, because they don't fit into the regulations of how their health insurance is, you know, how the broader scheme of things. So we're not the only people that are affected by it, but I think what's happening in our country anyway, especially with health insurance, is that patients don't know their rights. They don't know their own health insurance plans. And then when they're forced to have to use it, they go into complete overwhelm because it's so confusing. It's like you and I speaking to an attorney. I don't know legalese. I know medicalese, but I don't know legalese. So it's very frustrating. And I think it's so wonderful that there's people like you that really have the guts to stand up and say, hey, I want to advocate not just for me and my profession, but for also the patients out there that really have never had a voice, nor did they even think they had a voice. So amazing. So you just explained to us what advocacy is. And, you know, you and I spoke last week about something called a traditional advocate versus an armchair advocate. And I mean, I don't know if I've fully have that right. So maybe you can explain it to me again and tell everyone else what that is.
Yeah. So one other thing that I realized is that for many years I was not involved and didn't do these kinds of things. And then I had that aha moment, and it dawned on me that I had to educate members of Congress. So when we talk about advocacy, another word you might call it is lobbying. And so sometimes people associate that to mean a bad thing because, of course, I think there are evil lobbies and, you know, people who do things that maybe aren't so good for the country as a whole. But there are good lobbies and there are good PACs, and we're trying to, you know, do the good work and get things done. So when we talk about traditional advocacy or traditional lobbying, that is going to be at either a federal or a state level, and you are either going to go to your state's capital and meet with your state senator and your state house or assembly person, or you will go to Washington, D.C. and meet with your federal state members of Congress. That would be your senators and your House of Representatives member. And what you will do is you would get a meeting with someone in their office, and you would speak to their staff, and their staff are so important because they are the right-hand people for them to tell them like what's happening on the ground and what they should pay attention to and what's important. So what you do is you meet with them and you educate them on the bills that are introduced into Congress, whether that be federal or if you're on a state level, it's going to be at the state Congress. And everybody, you'll have a bill number. So for federal, we have the American Physical Therapy Association when it's for physical therapy, and they would give us different bill numbers and different topics, and we would go and you would ask the member of Congress, will you co-sponsor my bill? And that's what you want. You want them to sign on to the bill. When you get enough people to co-sponsor the bill, then it will get voted on and then it can get passed. So right now, like even speaking in the stimulus package, what we're seeing this week for the, Biden stimulus package, what you're seeing is it came out of committee. First, it goes into a committee. They voted on it. They all said yes. Now it's going to go to the House floor to get voted on there, and it will hopefully pass. Then it will go to the Senate. It has to pass through committee and then either the House or Senate and then go to the other one, depending upon who introduced the bill. So traditional lobbying is pounding the pavement, going to the legislator's office, saying, hey, will you co-sponsor this bill? And then armchair advocacy. So I've coined that term. I like that because, traditional advocacy, going in person in an office takes time. You have to take time off of work or school or whatever you're doing. You have to pay to get there, either flying or train, or, you might have to, if I go to DC, I have to stay in a hotel. So it's time and money. And also, I think sometimes for some people, it can be a little bit intimidating to go and have to do that face to face. You don't know what to say. So I like to call armchair advocacy. And those are things that you can do from the comfort of your own home. And those are so easy. You could call your members of Congress and tell them that, you want them to support a certain bill. That's similar to going in person. But other things you could do is you could go to the legislator's website, sign up for their email list. You'll get notifications about things that they're doing. You can also go to their website and send them an email right from their website, and it goes directly to their inbox. And you can tell them there on the email about things that you want them to support, that you want to have them pass and co-sponsor there. Other things that you could do is you could follow them on Twitter and Facebook. All legislators, whether at a state level or federal level, have Twitter and Facebook. You can follow them there. You can send them messages. You can interact with them. You can like, reshare, retweet, share on Facebook.
Do they actually get back to you?
Sometimes they will respond. I have had people respond, on a federal level and at a state level. I have gotten a lot of recognition for all of my posts on Twitter. I just moved, so it's now my previous state senator. When I saw him at a town hall before COVID, I went in person. He said, oh, I recognize you from Twitter. So people start to recognize you and they know who you are. And then also you start to become a valued voice. They see that you're posting about things that are interesting or, that they care about as well. And then you become someone who's a trusted resource. Speaking of town halls, you can also go to one of their town halls. They have them now virtual or telephone, and you'll know this by signing up for their newsletter or seeing their post on Facebook or Twitter. And then when you go to a virtual town hall, many times they allow you to submit questions in advance that they'll answer live, or you can write in the chat box your questions and they might answer those live. So that's another way to engage with them. But basically, the true heart of advocacy is building the relationship. You have to try to build that relationship to try to, have that conversation with them to help them realize the things that are important to you are important to many people and that they should listen to you.
So in terms of our profession as PTs, what are some of the things that you've advocated for that you've seen really be helpful to our community of patients and really in general, every patient out there? What have you seen change?
Yeah, so there's a big one right now, and the big one is that Medicare, starting in January 1st, 2021, they wanted to cut payment for physical therapy by 9%. We advocated hard for that cut to avoid it back in 2020, and because of that, Congress actually wrote it, into a bill, and it's down to, I think, maybe 2.7% of a cut. but we're still going to advocate to try to eliminate the 2.7%. And the reason why it's so important, even if you don't have Medicare, is because whatever Medicare does, it's a domino effect. The rest of the commercial insurances will do too. So if Medicare gets cut, then United might cut, Blue Cross Blue Shield, Oxford, all of them. And why is that important? Well, if PT practices get paid less, they might have less time to see you. You might get less visits. Many businesses might not be able to sustain their business and be able to stay in practice, so they might have to close. Then that would mean less PT businesses and less places for you to go. Maybe you're going to have to go a lot further. You know, in New York City, we have plenty of, you know, businesses and PT practices, but I'm sure there have been some that have had to close due to the pandemic. But now, you know, on top of the pandemic and all of the financial hardships that everyone has endured with that, cutting payment at this time would also be detrimental. Many places might close. And then we have a snowball effect. Maybe it's just easier for people to go get an opioid prescription, and then you can get that dependency. There's a huge snowball effect that the Medicare cut would have on the entire health system. Another big one, you know, similar to what we're doing now, you and I have treated patients on telehealth. Before the COVID pandemic, they basically, you could see someone via telehealth, but you would not get paid for it. It was not a paid service that Medicare paid for, and nor did many of the other health insurances. Because of the pandemic, you got what's called a COVID waiver. The Health and Human Secretary Service, Alex Azar, back in 2020, he declared an emergency. And so then Medicare started paying for telehealth, and they still are because the waiver has been extended. So then also the domino effect, many other insurances also started paying for telehealth services. So we were able to provide services to patients while they didn't want to go into clinics, or, you know, that they were nervous, or perhaps themselves weren't feeling good sometimes on different days. And so that's something that we advocated for. It took time. Medicare just didn't actually allow us. We advocated for that. Then finally Medicare said okay, and they gave us that waiver. But now, you know, the horse is out of the barn. People are used to that. They want to maintain their telehealth privileges. And so that's something that we are advocating for, to keep as a permanent, you know, right to be able to offer patients that service in, you know, conjunction with also going in person. So,
you know, when we spoke last week, this goes beyond the 9% pay cut of us getting paid as practitioners. But what I think it also does too is it takes away some of those appointments that patients have had in the past as well, right? So this, you know, we had this conversation about how when a patient doesn't necessarily understand their personal health care benefits, something as simple as, you know, when a patient calls and says, I have, you know, 60 plus visits a year, but then they really can only use 5. So there's this big duping system that's going on. So the patient believes that they have one thing, but then when we go get it verified, we see a completely other thing. So you know, it goes beyond us getting paid less, but it's a lie to the patient, really, because they think they're going to be able to come in for treatments. And it's like, I don't know about you, but I can't necessarily fix back pain in 5 visits, right? You know, or you can't fix an acute radiculopathy or nerve pain in 5 visits. So, you know, what have you seen with that? I mean, tell us the story that you told me last week about how, was it Medicare that kind of oopsed on a code, right? I mean, that was just so telling, right? It's so telling for our system.
So there are, you know, the good work is not done. There are so many parts of the healthcare system that I would say are fractured and need help. And so 2 of the things that you're talking about, one of them is prior authorization and what we would call administrative burden. And the American Physical Therapy Association for Physical Therapy is trying to work on that. I'm not sure, but I would absolutely assume that the American Medical Association is working on that for physicians as well. And I don't know about your acupuncture association, but prior authorization and, administrative burden, all the things that we have to do is just frustrating for the practitioner to have to fill out all this paperwork. And when someone comes into our offices, they're going to think they have 60 visits per calendar year. But because they're this medical management company in the middle who is sole purpose is to not give you visits and to siphon the visits, give you 5 visits, then you have to fill out more paperwork, give you another 5 visits, cut you down to 4, to 3, to 2, to 0. Their sole purpose is to save the insurance company money. And this is true. I treated once a higher up at an insurance company that I won't name, and he told me that is the sole purpose, and everybody knows it. So, that prior authorization and management is frustrating. So that's one thing that we're also trying to work on. But the other thing that you're talking about is the NCCI edits. Medicare said that, basically when we bill for treatment for patients, we are billing codes. And what happened is Medicare kicked back a whole bunch of visits that when certain codes were billed together, they said no, that's not possible, and you can't do that, and the claim is denied. And then the American Physical Therapy Association advocated against that, and Medicare did say, oh no, that was a mistake, we'll fix it. And then they fixed it, and then they actually did, I didn't tell you this, they went back on their fix and they said no, they're going to do it again. We advocated again, and then they said, okay, we're going to fix it. And then, but what happened is all the commercial insurances also said, okay, well, we're not going to pay for that either. And so even though Medicare had said, oh, we made a mistake, we're going to fix it, it has taken a whole year. This was 2020, this happened January 2020. It's taken a whole year to get the commercial insurances to also say, oh, okay, we will pay for these codes when billed together. So we're talking about now healthcare billing, and that we're doing advocacy for that too. So, if you come into my office, and this happened last year, I had to keep rebilling things because of those edits, and then patients are confused. They're wondering why you're billing them multiple times, and I have to explain to them, well, it was an insurance error and it's a coding issue, and it becomes complicated. And so we're advocating for these things as well.
Yeah, I don't know if you can see Natalie, she said so much administrative work and the patient does not get the treatment they need. It is so true. It's so true. It's interesting because I went to physical therapy school in Europe. And I remember, you knew that, Theresa, right? That I went to school? Yeah.
Oh, I'm not sure I did.
You didn't? No, I went to school in Holland. And
oh, wow.
Yep, and I was there for 4 years. And so what was so amazing about it was, we didn't have any prior authorizations, nothing. So when I came back to work in this country after I passed my boards, I was working at Lower Manhattan Physical Therapy, and I was like, wait, what do you mean? The doctor has to tell you that you need to come in for, like, you have back pain. Like, I specialize in back pain. You don't need surgery. Why can't you come to see me? And it was just this really weird thing. And then you guys fought for this, no prior authorization, or what we called it direct access, right? Was that it at the time? So there are, states now that have direct access. So you can just go to a PT, but then there's more stipulations, right? You can only have 5 visits, and then you've got to go get a script. But like, who knows these laws? And as well as I do, patients never really read the whole, they get this like beautiful PDF of their outline of their insurance, and then they're like glossed over. They think they have everything, and then they get to the, treatment, and, they're paying $100 a session when they're supposed to be covered, but the $100 is actually their co-insurance. It's so crazy. What did Sandra say? So many plans say you get PT and acupuncture, but goes to your deductible before it's covered. Is there a way to get it covered, referral from a primary? Yeah, so I think Sandra's saying, like, is there another way? Are you saying to like skirt the issue of a deductible because you've got in-network plans and out-of-network plans? So here's the other crazy thing. I'm a solo practitioner. I own my own business. I don't have anyone. I'm not on anyone's plan. I don't have an opportunity in the state of New York to get an opt-in for an insurance plan that is not on the exchange. I am forced to be on the exchange, and the exchange gives only in-network provider. It only gives me access to in-network care. Now, it also, you know, God forbid with cancer, if I wanted to go to Sloan Kettering, off the list, can't go. So there's all these stipulations in these insurance plans. And even I, as a solo owner and entrepreneur, I don't even have the right to pay top dollar to not be on a plan that has out of network benefits. So that's mind blowing to me. And is that something that we can even find advocates for? I mean, how do we as people that are solo practitioners, and it's not just me being a solo practitioner as owning a PT or an acupuncture clinic, but it's your freelance person. They don't have access to out of network care. I mean, you're very lucky. The patient has to meet their deductible, right? No matter what. Yeah. Thanks, Annie. I mean, so, you know, Theresa, you're lucky you have Greg's plan, right? Your husband's plan. He's got great benefits. You know, I would never have access to that because you're part of a group. So I think people are just really so confused when it comes to their insurance plans, and everything is just so different from each other.
Mm-hmm. Everything is different. There's a lot of variability. And, you know, that is one of, I think, what we talked about, the fractured healthcare system, is that healthcare coverage is tied to jobs. I think that that's a major flaw. And we have seen that flaw because of COVID, because people have lost jobs and now they have lost healthcare. So I think that's something that we also need to try to work on. Is that it shouldn't be tied to your work. People stay in jobs they hate because of the health insurance. Right. You know, when my husband tells me he's having a bad day in work, I'm like, well, you can't quit because that's our health insurance. So, no, you have to stay.
Yourself to the desk.
I'm like, no, because, you know, I, like you, am a solo practitioner, yeah, and it would be hard for me to get health insurance. A lot of times you have to have at least 2 employees to get a group health plan. And as a single person, it's difficult. But one thing that you touched on that I wanted to mention when it came to Advocacy 101, helping people to understand, is realizing that there are federal issues and there are state issues. And you mentioned what we call direct access, and that is the ability for you to go directly to a healthcare provider without getting a physician's prescription. So for physical therapy in the state that we live in, New York, we do have direct access, and all 50 states do have that some form. Like I believe in Texas, theirs is very restrictive. You can go one time for an evaluation, then you have to go get a physician's prescription to get physical therapy. In the state of New York, we have some limited. It is, you can come for 10 visits or 30 days, whichever comes first, then you're supposed to have a prescription. So on a state level, we are fighting for unrestricted direct access, meaning that you wouldn't have to follow those rules and those stipulations. So state direct access is a state law, and if that's something one is interested in, either on the patient side or the professional side, you would want to advocate to your state senator and your state, in New York we call them assemblymen, it's like the House, or assemblywoman, and you would want to work on that. If you want to work on things like, you know, telehealth and the Medicare cut and payment and things like that, that would be more a federal bill, and so you'd want to go to your federal legislators.
And what was the reason? What was the reason for the physician acting as the gatekeeper for? I mean, because for you and I speak to physicians, you know, about patients. You know, we communicate all the time. So why does it's a financial issue too, right? I mean, it really would drain the system more. You know, you would see that a physician's visit is going to be way more expensive just to go back to say, hey, how you doing? Bend, straighten, how you feel? Great. Okay, well, I'm going to write you another script. It seems so redundant. I mean, what's the reason? Is there a reason in the laws? Is there a reason in why?
Well, there's history there. The history is now that we are all doctors of physical therapy. We have great clinical and analytical skills. We are able to problem solve and assess someone all on our own. We don't need someone to tell us what's wrong with the person. I know just by examining you and interviewing you. However, the profession didn't start like that. It started off as a certificate program, then it became a bachelor's program, then it became master's. So as the physical therapy profession grew in knowledge base and we got more education, we got to be better practitioners. But that's not how it started. So it started where we were under the guise of a physician's, direction, and we needed them to help us because the education level wasn't there. But now the education level through the years has increased, that everyone coming out is a doctor of physical therapy, that we don't need a physician to guide us and tell us what's wrong. So at this point, that's why all 50 states in America, we are fighting for unrestricted direct access. And at this point, it has become what we would call a barrier to care, decreased access. For you to come see me, if you have to go to the physician's office first, that's time and money. You're going to have to pay probably a big copay or a co-insurance. For me, I personally hate going to unnecessary visits. So to have to go to a gatekeeper to get a prescription, to then go see a physical therapist, it's annoying. You don't want to have a referral. You want to just be able to go if you need it. And physical therapists, can treat the whole body, and we can do things without prescriptions and opioids, and a lot of people feel better without ever having to take any kind of medication or pain pill. So I think the history is why it was the way it is with the restrictions, but at this point that's why we're fighting for that, and at this point it does just become a barrier to care.
Yeah, totally agree. So let's talk about work from home. It's obviously, it was just such a shift for us treating patients, going from, what is she saying here? As a nurse practitioner in New York, I'm still glad that I can get a massage from a PT to say, hello, I can see your patient. A message from a physical therapist to say, oh yeah, totally. I think it's great. And especially for those of us that have connections to other healthcare providers that cross refer and whatnot. It is great that we're finally kind of back in action, all COVID safe and precautions and whatnot, but we're at least able to treat patients again. So let's talk telehealth. I have a list of therapists I can refer to, but patients can still look for convenient therapists on their own. Yeah, definitely. So let's talk telehealth, because it was definitely an interesting thing to experience, right? And I actually did PT telehealth, and I know this sounds crazy, but I did some acupuncture telehealth calls, and I taught patients how to do some self acupressure to follow up with some of the work that we did. But I also taught them how to do gua sha, which for you know what it is, but for those of you out there, gua means to scrape and sa means stagnation. So this is a 5,000-year-old art where you actually take, and I had them take a bottle cap, like a Solgar vitamin cap, because it's not serrated on the outside, it's like smooth. So, and actually one of my patients didn't have any vitamin cap, so she used a spoon, a soup spoon, and she was having
I like a butter knife turned upside down.
Yep, or a butter knife, and she was having tennis elbow, or from typing so much. And I sat there and I taught her how to scrape her own arm. So it was this really interesting experience to get on telehealth and to be able to articulate to someone how they could care for themselves in a way that you're just so used to doing automatically. It was a whole different experience. It was great for patients, but I think in a way it gave us a whole nother way of treating patients, which is super cool. And I hope they don't take that away from us, because I know that you said the moratorium goes until what, December? Possibly?
I forget if it's September or December 2021, but that's when the waiver has been extended to. But yeah, I just want to touch on telehealth for a second. I had that on my to-do list for 2 years. I had a Post-it note above my desk set up telehealth. And it just seemed so complicated. And I don't know, I didn't want to dedicate the time to trying to figure it out. I had gone to talks about it. But then obviously back in March, you know, when I decided to shut my clinic down for a little bit, I said, okay, well, now I have the time, so I'm going to figure that out. And I did, and I set that up, and I wasn't sure how it was going to work. And oftentimes I would catch myself trying to touch people through the screen and realizing I can't touch you over there. But you know, telehealth I still am seeing some telehealth patients. Some people, older people, still are a little nervous. They haven't had the vaccine. But, you know, there have been times where it has been so invaluable. Actually, just the other day, I had a referral from a wife to a husband. He was trying to lift up the bed and plug something in, and he hurt his back. And we did a telehealth visit just last week, and I just gave him some gentle mobility things for him to do and advice. And it's immediate. If someone immediately hurts themselves, I mean, what else would he have done? He would have suffered in pain, perhaps gone to urgent care where, you know, maybe he could contract COVID there. But even just, you know, the immediate access, when we talk about barriers to care, telehealth is one that decreases that. People who live in rural areas where there's not a healthcare provider near them, when, you know, there's bad weather, there's been snowing here in New York, you could have a telehealth session then, but we could help people. So I was able to help people in a very immediate fashion who had hurt themselves. One of my patients during this pandemic, she fell off her chair while she was working and she hurt her wrist, and, you know, I had to help her with that. I mean, there's been, you know, some really valuable people that I have given sessions to because I was able to immediately give them that feedback and tell them what to do. So yeah, we don't want to lose that privilege. And when the waiver expires, the ability to do telehealth will go away. And so that is something that we are advocating for, and I hope that we are always able to do.
I think the best example of telehealth that I gave over COVID was I have a patient who's a drummer, and he brought me into his house and he brought me over to his drum set, and I was like watching him, you know, play his drums, and I'm like, I know exactly why your neck is bothering you, you know, and I was able to, like you said, immediately give him, you know, either stretches or like how to move or where to set the, you know, it was so great. He was so happy and so appreciative. So let me ask you something then for this advocacy with the telehealth. If it goes away in that time, how do we then advocate for it as either practitioners or patients that are possibly getting telehealth? Do we have an opportunity as just the layperson that have no, you know, talks or liaisons between this federal government or the state government? How can we fight against that?
Yeah, so the physical therapist profession has our amazing organization called the American Physical Therapy Association, who is advocating hard for this. And it's apta.org, and on there's an advocacy tab. You would click on the advocacy tab and you'll see the hot issues. Top 3, telehealth is one of them. Click on the telehealth picture, and it will tell you what's going on. And from there, it will take you to what's called the Legislative Action Center. You don't have to be a member. It can be a layperson, anybody in the profession, or a patient, or anybody who's just interested in this. It will take you to the Action Center, and there it will show you the bill numbers that the Physical Therapy Association is working with members of Congress on, or bills that are introduced. And from there, you can just enter your name and address. It will auto-populate who your members of Congress are. You don't even have to look them up. There'll be a nice template letter already formed for you, and I think you could add in some additional words if you had other things you wanted to say. And then you just press the send button, and it would send the template letter advocating for telehealth right to your members of Congress, to your senators, to your House person. And that's what I call armchair advocacy. You do that while you're watching Netflix, and you've just sent a letter on the behalf of yourself for advocating for telehealth. So that's a way that anybody could just do that.
Now, do they need a certain amount of these letters to come in? Like, how do they wind up, you know, voting yay or nay for these bills? I mean, how really, I know the influence is coming from us wanting them to change, but like, how do they actually say, yes, I like woke up and was like, hey, yeah, I want to vote for this bill and say yay today instead of nay? Like, how do they make those changes?
So definitely the more support and the more outcry there is, legislators pay attention to that. And I just want to mention one thing that's important is the word constituent. When you either email on your own, or if you're going to call, the first words out of your mouth to your senator or your member of the House is you want to say, I'm a constituent. It means I'm a voter. And they will listen to you because you're important to them. They're working for us. We are, they're working for us. Their job is to serve us and to be a public servant for us. And so if you get enough people to bring this to the table, then they'll pay attention to it. It'll become a bigger issue. So you can either, send that email, or if, from 9 to 5 when they're open, if you actually want to call, you can also call their office. They log every email, they log every phone call, and when there gets to be enough push, then it becomes a more important issue. Like the Medicare cut, the 9% cut, right? The 9% cut, the 9% cut. We amplified the message. We cried out about it so much. We posted on Twitter. We posted on Facebook. We posted everywhere. We sent letters. We called. We did all kinds of things. I sent the link to the Action Center right to my patients and said, can you please fill this out? If you care about this. And, it got to the point where every legislator had heard about it. They all know what the 9% cut is because there was so much hoopla we had created and so much amplification of the message. So the louder the voice, the more powerful the voice, and the more important the voice becomes. That's why, for me, it's really important to try to teach people how to participate in advocacy so we can grow our message. If the message is bigger, we'll have a greater impact.
Wow, amazing. I find it also so overwhelming at the same time. I think because I just don't know how to do it, and I've never really, I don't think any of us are educated in it. You make it very clear and concise. I appreciate that, because even this is the second time I'm talking to you about it and I'm understanding more. So great. Let's talk. We just talked about telehealth. I did want to talk to you about this whole work from home issue. Sandra, I don't want to, I see what you wrote, and it says the US healthcare system is broken compared to other countries. We're driven by insurance companies and what they will or won't cover instead of what's best for the patient. In many cases, I feel like that is the case, being a provider for sure. And you see it firsthand in your own home. Annie, in the UK, the National Health System, you can wait months to be seen by a PT because there's a long wait list, and there's no way around this. Americans wouldn't stand for that. Acute issues become chronic. Yeah, that was what I was seeing too when I was living in the Netherlands. I mean, people would need, an MRI, and it's like, they'd have to wait a year, or if they need surgery or a simple meniscal surgery, and they're put on a wait list. So I don't know, I feel like they're all sort of broken, but if we take piece by piece and advocate for things that are, for the patient, I think that something can change, right? I mean, at least you're seeing these changes. So let's kind of move a little bit away from the healthcare issue, of the insurance issue, and move in towards this work from home situation, because it's been good for some and obviously not good for others. A few weeks ago, the New York Times did a whole expose on the primal scream, and that was all about moms and how many women, I think 1 million women actually left the workforce. And we talked about this. Annie, damned if you do, damned if you don't, I know. But all these women left the workforce, and what I read, it was part of this whole expose, was how women are they're the ones that take care of the home. I'm generalizing, but in this piece, this is what they were saying, right? So they also lost their jobs. So now they have this less income in their homes. There's all this more stress in their homes. And so these people, and now they're working from their dining room tables, so what have you seen in terms of your work from home? Because I think it's an epidemic as well, right? It's part of this whole thing. What are you seeing in work from home situations?
I think, working from home is a double-edged sword. One of the amazing things tying in telehealth is that I have been able to do telehealth with patients in their home. I don't have to go to their home. Before I would have patients send me pictures or email me pictures about their work from home setup. Now, literally, I will have them sitting at their computer. They'll put the phone on the side so I can see what's going on.
Yeah.
And I've been able to do like ergonomic assessments based on, the telehealth capabilities and being able to do that. So that is kind of a cool thing that happened. But I would say a lot of people, besides just the mental fatigue and the stress of just constantly having to be on all these video calls and the Zoom calls and, just having to, another thing, even for my own husband, is that the lines are blurred now between when work ends and when work stops.
Yeah.
And it has become a 24-hour thing. And I'm not sure when people are, having spouse time or having pet time, or, my dog literally paws me as I'm sitting on the chair because he wants attention, when people are having time for their kids, when to
Just for
eat dinner. So,
themselves. When
yeah, or
for
themselves.
themselves.
Exactly.
Yeah, self-care, even though all you read about on blogs and social media is all self-care, 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 but it's like, who can have self-care if you're actually, your boss can email you at midnight and you're still at your computer? It doesn't,
Yeah.
it's not ending. It's like this, it's like a chronic loop that's going on, I think, for sure.
Yeah, the line is blurred between that, and that can be frustrating. So I think, as we come out of this and go back to, no COVID, we are going to have to, I'm not sure if that's
I don't know what that
a word.
is going to look like. Yeah.
Exactly, the new normal, right? That cliche.
Yeah.
But we are going to have to set up boundaries. There are going to have to be some boundaries again. So that's, from a mental health perspective. But from a physical perspective, I'm sure you're seeing it too. People are in a lot of pain from all of the extra sitting.
Yeah.
And the extra sitting and the longer work hours, because they're not commuting, they're not moving, and people also, we're not going out shopping, we're not going to the movies, we're not visiting friends as much, so you're not moving, and so people are sitting a lot more. And so I'm finding that people are having a lot of pain from that. People are having back pain, their hips are very tight, their hip flexors, their hamstrings, even for myself, I have to lie on the floor, do a lot of mobility work. So that's one of the things that I've been teaching people also, is to just how to do mobility work on their own and work on their, joint mobility as well as muscle flexibility and fascial tightness. But people are having a lot of lower back pain, and people are having, I think, a lot of plantar fasciitis. That's when the bottom of your foot hurts because the legs are just not moving and they tighten up. And also people are having a lot of neck pain from sitting at the computer, from typing on the phone. And so we're seeing a lot of that. And I think the fact that people are physically not feeling better, aren't feeling good, is making them kind of feel bad and bummed out. And, injuries seem to be going up. But on the flip side of that, what I'm concerned about as a physical therapist is, after this is over and people start to go back, how many injuries are we going to see? Because everybody got deconditioned. Want to talk about strain on the system? People are going to be deconditioned and then possibly try to, do too much too fast, or go do things that they used to do, a year ago. A year was a long time ago.
Yeah.
And so, they might hurt themselves. For older people over 65, all my Medicare patients who have been sitting at home, not doing anything, some of them that I still see on telehealth, they don't even really go outside.
They play Words with Friends for hours.
Their muscles probably have deteriorated, their cardiovascular system, and their balance. I'm afraid that we're going to have a lot of falls in seniors once everybody starts to get moving again. So, I hope that's not the case. Time will tell. And that's another reason why I think telehealth is invaluable, because we need to keep people strong during this, so that when people do start moving again, we don't see a higher prevalence of, injuries after all of this.
Yeah, I think also too, to not just the work from home situation, but like how many kids are home too. And, I treat a fair amount of high school kids in my practice here in Nyack. And one of the moms came in and was like, my son basically is laying in bed for like 20 hours a day. and he's, this high school track athlete. So all of their, their sports have been canceled. And now this kid is showing signs of just depression. And he's, flat affect and very sluggish and very tired. And what's interesting, because in 2017, way before what we just went through, they did a study on posture and its relation to depression or depressive moods. And, that forward head, rounded shoulders, kind of slumpy position there's a big correlation between those that have depressive disorders and postural relation. And in the study, they had them just change their positioning, just even, pulled their head back, brought their shoulders back, and their whole mood changed. And those depressive behaviors and posture also played into cognitive decline. So, here we have these kids that are trying to do these Zoom calls that are so different than high school or even college. They're laying in bed and they have a cognitive decline and they can't even comprehend what's going on. So it's just this whole downward spiral that's going on. So that's why it's so important when I tell my patients, like, I don't care if you have to set an alarm every 30 minutes, but get up, do ankle pumps, raise your heels, walk around the dining room table, get off the computer. How many people have glare on their screen, or wearing bifocals, or, they're doing all these things with their neck and they can't get comfortable. And they're working 15 hours a day, right? They're not staying hydrated. I can't tell you, I'm sure for you too, how many patients are like, I can't drink while I'm working. Why? Because I have to pee. Okay, that's a bad thing. I can't get up and pee every 20 minutes. Well, so you're going to dehydrate yourself and you're going to shrivel up and be in a pro-inflammatory state forever. So it's really it's just a bad cyclical loop I think we're in.
I think also, yeah, I also treat children. Some of my patients are children also, 7, 10, 15. This has been hard on them. Sometimes I have to say that, I feel that one of my jobs and hats that I wear is to be supportive emotionally to them and to talk them through things. As healthcare practitioners, I spend a good amount of time one-on-one with the child. Often the parent will have left them or dropped them off, and we're just one-on-one, and sometimes they tell me things that maybe they wouldn't tell their parent that they're struggling with, and you can tell they look sad and they're just not enjoying the Zoom calls. They're not enjoying the online learning. It's just not as engaging. And they also, the kids are having body feelings too, and they're not feeling good because kids want to run around and, jump around and act crazy and wrestle. And when you don't see your friends, you can't really do those things. And so I think also, mentally and emotionally, they're containing all their energy, and that's hard for them too. And I do see that too. I think children are feeling a little depressed through all this, mentally, and then also physically it's affecting them too.
Definitely. All right, Miss Theresa, thank you so much for coming. You're amazing.
Thank you for having me.
So much knowledge around this, and it's just so great. So if anybody wants to get in touch with you, they want to find you, I know that you have a great thing on your website on posture and sitting postures for low back pain. I think if anybody has low back pain and they need some guidance, where can everyone find you?
So my website is Marko, M-A-R-K-O, physical therapy, all one word.com. And on Instagram here, it's Dr. Theresa Marko. And on Twitter, which is my favorite forum, it's Theresa Marko, Theresa with an H, Theresa Marko PT. Twitter is fierce. One thing that we didn't mention, we didn't talk about Twitter that much, is I love Twitter because you can find people who are interested in the same causes you are. You can network there. You can amplify each other's message. You can become an army on Twitter. Twitter is very fierce in that way. I know Twitter can be used for a lot of evil, but I see Twitter as brilliant and can be also used for a lot of good. So I like Twitter for that reason. So come join me on Twitter and make our voices louder.
Amazing. I'm scared. You tried to teach me how to use Twitter and I'm like, no, I don't know how to use it.
It's not that hard.
I know, it scares me, all these social media channels. This is hard enough. All right, well, thank you so much, my dear friend. Everyone, it's just been a blessing. Like I said in the beginning, it's week 8. Week 9 next week, we have another dear friend of mine. She's a therapist. Her name is Patricia, and we are going to get into the psychology and behavior of the athletic mind. So for those of you that are interested in the psychology behind being an athlete, this might be one for you. And like I say, integrate health, embrace wellness, and join the collective.